Okay, we're going to start part 2, and this is where we left off. Again, make sure you read your transcripts for this. It'll give you more information. So one of the roles of government, too, then was to ensure fair competition among healthcare providers. So in 1890, they actually passed the Sherman Antitrust Act. And even though healthcare providers weren't then, it's been a law, been around for many years, and basically it prohibits the formation of monopolies and restraint of trade. So that's why we have the competitive healthcare industry that we did. Then in 1914, that act was modified and was called the Clayton Act, and that prohibited price fixing and exclusive dealing. So for example, all the companies in the United States that make prosthetic devices can't get together and say, hey, this is the price we're going to charge, and no one can charge anything else. The other thing that the government does as a lawmaker, they protect the public. So the FDA, which was established in 1938, we've talked about before, that's how the federal government regulates the new drugs, new devices, new cosmetics that we use. The regulation for that ensure public safety. The others you can read over. So now we're going to go to part 2, continue on. And this one is going to talk about healthcare spending and the impact on the United States and the jobs, and we'll go from there. So healthcare financing, that's where we collect and pool funds to pay for healthcare services in our system. And that's that mechanism of payment. So we talked a little bit about insurance. Now we're going beyond that. Healthcare expenditures, that's the total value of healthcare services in our system during a period of time. So when you track expenses, you look at the category of service, who pays for that service, and then what the payer is. The United States healthcare system is the 5th largest sector of the economy in the United States by sales, so it's huge. It employs 14.3 million people. It's more than any other sector. It's one of the fastest growing sectors, or health occupations. And by this time last year, they had 3.2 million new jobs, and that continues. In 2017, the gross domestic product of healthcare services, in other words, the impact on our economy, was $19.39 trillion. And the national health spending was $3.6 trillion. So as a percentage of the gross domestic product, 17.9%. The U.S. population in 2017 was 325 million. So per person in the United States in 2017, we spend about $10,739 on healthcare. Now I know I don't spend that in a year, more likely you don't. But overall, if you take every citizen, that's the cost. This is just a little graph that shows you the spending of healthcare in the United States compared to other countries. So people like to compare us to Canada. So in 2008, now this is 2008 numbers, so it could be adjusted to 2017, but the gap is about the same. You see, in 2008, it was 7,538. Now we're over 10,000. But just look at us compared to Canada, and the Great Britain. You can see that the United States is heavily vested. By category in 2017, the largest category that we spent our money on was hospital expenses. Then it was physician and ancillary. Then it was nursing care facilities, dental, and others. Now these are in billions of dollars, so the only one at this point in time that's over that is trillion, and that's healthcare. As a part of our economy, you can't underestimate health services. So who is spending this care? I mean, where is the money going? How is it being spent? If we look at hospital care, and let's just look at that one. Hospital care for 18 and younger, $14.68. 17.68, 19 to 44. 45 to 64. You'll notice as a person ages, the amount spent gets bigger. This is the distribution by sponsor detail. So for example, Who's spending all this money? Up here, we got the federal government. We've got Medicaid services, Medicare, other health programs excluding Medicare, private insurance, marketplace credits. Okay, that's what they're spending in billions, 944.1. Then you get to your households. How much are people spending out of pocket? 38%. Employer-sponsored health insurance premiums. So what's your employer paying? What is you getting out of Medicare payroll tax? What are you getting out of Medicare Part D and B and D premiums? What are you getting for direct purchase insurance? So people just go out and buy insurance themselves. Or medical portion of property and casualty insurance. For example, when I buy car insurance, I have a medical rider on that. I pay a premium for that. So how much are insurance companies collecting? Then you got private business premiums. What's your employer paying? What's your Medicare payroll tax? What's your workers' compensation? Then you got state and local government. So if you think about what you pay for health care, let's say if you have a health insurance plan and you're paying a premium, you're paying that, you're paying FICA, aren't you? You're paying other tax that support Medicaid. You're paying a portion of your car insurance for medical. If you look at everything the average person is paying, we're paying a lot of money for health care. Health spending distribution by payer. Okay, so here's what we're paying in 3.3, and this is a 2016 slide, just gives you an idea. But employee-sponsored private health insurance, 1.1 trillion, 88%. Then marketplace, other direct purchases, medical and P&C insurance, and Medigap. Okay, now we're going to go to the next part of this. And I don't want to spend a lot of time on this because, one, I'm not going to test you over it. There is a question in the self-assessment for you to do on this. But everybody talks about how much better Canada's system is and how much better Great Britain's system is because they have an insurance for everybody. And the politicians like to bring that up all the time. We need universal health care. We need a one-payer system. We need it like other countries. And I'm not saying I'm for it. I'm not saying I'm against it. I'm just saying I'm providing you information on this. So on Part C, on the slides on this for the rest of this week, you can see how it's done in the United Kingdom and how it's done in Canada. Okay. So they're a mixed delivery system in these. A mixed delivery system is where you have private healthcare and providers. So for example, we have our government system in the United States, VA, military, Indian. But in the United States, they have a single versus, or I'm sorry, in the United Kingdom, they have a single versus a multi-payer system. So in the United Kingdom, Great Britain, the public is a payer. It's funded by the public, and you get your basic services. They have a private payer, and you can have employer plans in that country. In Canada, there is a single public payer in every province and territory, and it's limited or no private payers. So the United Kingdom, it's called the National Health System. In Canada, it's called Medicare, and you can see how that's organized. 5 single-payer systems in the United Kingdoms, and providers receive a salary, fee for service, or capitation. So they actually, the doctors in that country are employed by the government. They get a salary, or they get so much money for what they do, or they get their cost capped. They'll say, you do this, but I'm not going to pay you over X amount of dollars. In Great Britain, the National Health Service governance and responsibilities are listed there. And their funding per capita in 2009 was a lot lower in the United States, but it's paid 76% through payroll tax, or national taxes, then 18% payroll, and then 6% other sources. It provides universal health coverage for all residents. That includes primary care, the ability to see a specialist, the ability to get hospital care, the ability to get long-term care, and preventative care. So one of the videos that you're watching this week is how other countries have provided, that was in the long-term care unit. But if you remember back on that, on how they provide care for their elderly. All of this is part of the National Health Service. Patient fees and those you can read over, and that you can read over. I want to get into Canada. Canada is very similar to Great Britain. It's paid by taxpayers. They provide universal coverage. It's different from Great Britain because they have nationwide and regional funding. The federal government does not run the regional health care plans, and they also cap limits on private health insurance. In 1984, Canada modified its health services. They gave more access, they lowered people's costs, and they defined medically necessary services. Now there's a key word. One of the things our government has done to try and control cost over the years is define what is medically necessary. In other words, you're not going to be admitted to a hospital unless it's medically necessary. And if you are admitted and it's not medically necessary, usually you don't get paid. Okay? So then they get into financing. So the hospitals and providers in Canada, the hospitals are a public institution. Their providers mostly work in private practice, and they get a fee for service. So they get paid for what they do. It's just, this is what you get paid. Here are the principles of Canada. Public administration of their services, comprehensive, universal, it's portable, and it's accessible to their citizens. In other words, everyone has access to health care, which not everyone in the United States does. Because if you don't have insurance, if you don't have the ability to pay, you can get minimum care, but to get accessible care becomes really hard. This part you can read over. They talk about universality, portability, and accessibility. In Canada, every resident has the right to health care. So you hear politicians say every resident has the right to health care. Okay? And people in the United States want to believe that. But the question is, do they want to fund it for everyone? Portability, it gets health care coverage if one person moves from one part of Canada to another, and you get health care regardless. Here's Medicare coverage in Canada. So it provides medical, surgical care, preventative medicine, hospitalization if you're sick or injured, provides for the provision of medical equipment, and dental surgery. If extended health care, there's no requirement if you need it. So that's dental, prescriptions, and eye care. And most territories provide some coverage, but the average person does have to pay some out of pocket. Private insurance in healthcare is available through employers or purchase. It's a supplement, and private insurance is 30%. Now, why do they have private insurance? Because when you get services in Canada, you have to wait for services. So if you want something done, that doesn't mean it's going to happen. People can be on a list for a new knee replacement, for example, for months. So people from Canada will often travel to the United States and just pay for those services rather than wait. The benefits of the Canadian public health system, statistics had shown, and this is an advantage of universal health care. They benefit from better health because they have access to care. Life expectancy at birth is more than 80 years old. It's one of the highest in the world. And infant mortality, because of access to care, has decreased. The United States has one of the highest infant mortality rates of developed countries. Why? Is it related to access to health care, or is it not? There's got to be a reason. So that's a disadvantage to the United States, advantage to Canada. Okay, so read the summaries, read it over. That includes this week. I hope you enjoy your assignments for this week. I think they're very interesting. And we will see you next week for part 2 of financing.